Post-procedure. Now that we've covered the essentials for your surgery day, let's look at what to expect following your procedure. Pain management. Managing pain effectively is crucial for your recovery. We'll guide you through the medications and techniques that will help keep you comfortable.
It is normal and expected that you will have pain or discomfort after spine surgery. Postoperative pain can last a few days or several weeks, depending upon your individual pain tolerance and activity level. This pain may include soreness at the surgical site, stiffness in your back or neck, or discomfort from positioning during surgery. You may also feel muscle tightness or fatigue as your body begins to heal. We use a multimodal approach to pain control, which means combining several strategies to help you stay comfortable. This includes oral pain medications, ice therapy, proper positioning, and gentle movement. In some cases, your surgeon may prescribe stronger medications for short-term use, typically before physical therapy or at bedtime. Staying ahead of your pain is important, especially in the first few days after surgery. That means taking your medications as directed and not waiting until the pain becomes intense. Once your pain level spikes, it can take longer to get it back under control. If your medication is scheduled every few hours, take it consistently during that time frame. If your medication is prescribed as needed, be sure to communicate with your nurse or care partner when you begin to feel uncomfortable. Don't wait until the pain becomes severe. Some patients hesitate to take pain medication due to concerns about how it makes them feel or fears about addiction. If you're using these medications as part of your short-term recovery from surgery, the risk of addiction is low. Your surgeon will prescribe only what is necessary, and you will taper off as your pain improves. If you have concerns, talk to your nurse or surgeon. We want you to feel safe and supported. Movement is also a powerful tool in managing pain. Walking and gentle activity help prevent stiffness, improve circulation, and support healing, all of which can reduce discomfort over time. However, it's important to balance movement with rest. Overdoing it too soon can increase pain, so be sure to follow your surgeon's guidance closely. If you are admitted to the hospital, pain medications will not automatically be brought to you unless you ask for them. Work with your nurse to keep your pain under control. Communication is key. You are not bothering the nurse by asking for help. In fact, your nurses want you to be comfortable and will work with you to find the right balance. The more effectively you manage your pain, the better off you will be. When your pain is under control, you'll feel better, move more, participate in your exercises, and ultimately recover faster. Special precautions. Your spine surgery may come with specific movement restrictions to protect your surgical site and support proper healing. These precautions are in place to reduce the risk of complications and ensure the best possible outcome. You may be instructed to follow the BLT rule. This stands for no bending, lifting, or twisting. These movements place stress on your spine and can interfere with healing. Instead of bending at the waist, use a reacher or ask for help when picking up items. Avoid lifting anything heavier than 5 to 10 pounds, about the weight of a gallon of milk. When turning, move your entire body as one unit rather than twisting at the waist or neck. To get in and out of bed safely, use the log roll technique. Roll onto your side, swing your legs off the bed, and push yourself up with your arms. This keeps your spine aligned and reduces strain. Your therapist will demonstrate this technique before discharge and may invite your partner in care to observe. Avoid sitting in low, soft, or overstuffed chairs. Choose a firm chair with arms to help you sit and stand safely. Change positions every 30 to 60 minutes to reduce stiffness and improve circulation. If needed, use a raised toilet seat to avoid excessive bending. If your surgeon has prescribed a brace, wear it exactly as directed. Your care team will show you how to put it on and take it off safely. The brace is designed to limit motion and protect your spine while it heals. You may be instructed to wear it when out of bed and remove it only when lying flat or as otherwise directed. You should not drive until your surgeon has cleared you to do so. This typically occurs after you've stopped taking narcotic pain medications and have regained safe mobility and reaction time. If your brace limits your ability to turn your head or body, you may need to wait longer. If you're unsure, ask your surgeon before driving. You may also be advised to avoid household tasks such as vacuuming, laundry, yard work, or lifting children or pets. These activities often involve bending, twisting, or lifting motions that can strain your spine. Focus on walking and light activity as tolerated, and gradually increase movement as directed by your care team. These precautions are temporary but important. Following them closely will help prevent complications and support proper healing. If you're ever unsure about a movement or activity, ask your care team. They're here to support you every step of the way.
Potential complications. Awareness of potential complications is important. Next, we'll go through what to watch for.
With any surgery, there is a potential for complication. We want to educate you regarding potential complications so that you can prevent their occurrence and provide you with the information to recognize a concern. Pneumonia. When you're not up and moving after surgery, your breathing naturally becomes more shallow. That means you're not pulling air all the way down to the bottom of your lungs, where it's needed most. This deep breathing is important because it helps keep fluid from settling in your lungs. Without that airflow, fluid can build up, bacteria can grow, and suddenly you're not just recovering from surgery, you're also fighting off pneumonia. When you're not moving, there are other things that can help keep air in your lungs so that fluid cannot get in. Cough. Take a deep breath and cough. This will help get air to your lungs as well as clear out any food that has accumulated. You should also utilize the incentive spirometer that was provided to you. It's easier to think of this device as a little deep breathing machine. To use this machine, start by putting the hose in your mouth and inhale very slowly as deeply as you can, like you were drinking a very large milkshake, and hold it for as long as you can. Then exhale. You want the bobble that you'll see rise to go up as far as possible. Repeat this process 10 times once every hour while you're awake. Upon completion, follow with a big cough. This again will help with loosening anything that has accumulated in your lungs. Also, make sure that you are continuing with normal mouth care at least twice daily, as we can all inhale bacteria from our environment. Blood clot. The second complication to be on the lookout for is a blood clot, or DVT, deep vein thrombosis. Blood clots are extremely dangerous and very painful. We take blood clots very seriously. One of the most effective ways to prevent them is by staying mobile. After surgery, your blood circulation naturally slows down, which can increase your risk of clot formation. That's why walking is so important. Regular ambulation helps keep your blood moving, supports oxygen flow throughout your body, and reduces the chance of developing a clot. Even short walks every hour during waking hours can make a big difference in your recovery and overall safety. Ankle pumps are crucial for preventing blood clots and reducing swelling. Pump the foot back and forth to increase blood flow to the shoulder. Ankle pumps may be done from either a sitting or laying position. Think of it as pushing down on a gas pedal all the way to the floor, and then bring it back up as far as you can. You should feel your calf muscle contracting, similar to how it would if you were walking. Repeat this motion for 25 repetitions 4 times each day. While blood clots typically form in the legs, it's important to be aware of the signs. Symptoms of a blood clot in your leg include redness, swelling, heat, and extreme pain. It typically starts in the calf area and will move around to the front of the leg. Should you experience this, you should contact your surgeon immediately. He will order a test and have you come in to determine the appropriate course of action. If you have a blood clot in your chest, you can have shortness of breath, chest pain, or both. If you have these symptoms, call 911. Do not take chances unnecessarily. Infection. Another complication to be on the watch for is infection. Infections are caused by bacteria, and the number one way to prevent them is simple: wash your hands. This is especially important if you're going to be touching your incision. Also, avoid putting anything on or near your incision. No creams, lotions, powders, or ointments unless specifically directed by your surgeon. These products can introduce bacteria and increase your risk of infection. It is important to follow your discharge instructions carefully. Most patients are cleared to shower within 1 to 3 days after leaving the hospital, but that means shower only. No bathtubs, hot tubs, swimming pools, lakes, or oceans. You do not want to submerge in any body of water until your incision is 100% healed. Germs live in water, and submerging your incision too soon can lead to serious infection. You'll also want to be mindful of your environment. Dust, pet dander, and anything that might be on your pet's fur can pose a risk. It's a good idea to keep your incision covered with clean clothing when around pets or in dusty areas. Some redness, swelling, warmth, or mild pain around your incision is normal. Your body is healing from surgery, but these symptoms should be minimal and gradually improve. If these symptoms worsen and the pain is intense, you may have an infection. Other things to look for include a temperature over 101, continuous bleeding, foul odor around incision, significant clear drainage or any yellow or green drainage or pus. If any of these occur, you should contact your surgeon right away. You may be directed to urgent care. However, it's best to contact your surgeon first. Skin irritation and bracing. If your surgeon has prescribed a brace, it's important to wear it exactly as directed. Braces help support your spine and limit movement while your body heals. You may be instructed to wear your brace anytime you are out of bed, and to remove it only when lying flat or as otherwise directed. Because braces are worn snugly against the body, it's important to monitor your skin daily for signs of irritation or breakdown. We recommend wearing a soft, fitted cotton t-shirt underneath your brace to reduce friction and absorb moisture. Even with a shirt, pressure points can develop, especially around the shoulders, hips, or lower back. Check your skin for redness, blistering, or areas that feel warm or tender. If irritation does not improve within 30 minutes of removing the brace, or if the skin becomes open, painful, or shows signs of infection, contact your surgeon's office. Avoid applying lotions, powders, or ointments under the brace unless specifically instructed. These products can increase moisture and friction, which may worsen irritation. If you experience excessive sweating, talk to your care team about strategies to keep the area dry and comfortable. If your brace feels too tight, causes pain, or shifts out of place, do not adjust it on your own. Contact your surgeon's office or orthotics provider for assistance. A properly fitted brace should feel snug but not painful, and it should allow you to breathe comfortably while providing support. Taking care of your skin is an important part of your recovery. By inspecting your skin daily and following your bracing instructions closely, you can help prevent complications and stay on track with your healing. Constipation. Constipation is a very common complication. It is a side effect of pain medication. It is also caused by dehydration, immobility, and low iron. With that said, the likelihood of becoming constipated is very high for spine surgery patients. We recommend that patients take both a laxative and a stool softener every day until you're completely off pain medication. The reason we ask you to take both is that they do two different things. The laxative is going to get your gut moving, and the stool softener is going to make the stool softer and easier to pass. If you follow this regime, you should not have a lot of difficulty with constipation. Exercise. Exercise is an essential part of your recovery. Your surgeon will let you know when it's appropriate to begin therapy based on your individual healing timeline. Every patient receives a personalized exercise plan tailored to their specific needs. It's important that you only perform exercises after being properly instructed by your physical therapist. Doing them incorrectly can cause unnecessary pain or even injury. If you experience any unusual pain while exercising, stop immediately and notify your therapist. They'll help you adjust your routine to keep you safe and comfortable.
Urgent care. Unexpected issues can arise. Let's discuss what to do if urgent medical attention becomes necessary.
Before heading to an urgent care, please reach out to the ortho coordinator at St. Elizabeth at 859-301-0405 during business hours, or contact your surgeon's office for guidance. If your concern isn't truly urgent, we want to avoid exposing you to unnecessary germs in those settings. If it's determined that you do need to be seen, both St. Elizabeth Healthcare and your surgeon's office have urgent care locations throughout northern Kentucky. However, if you are experiencing bleeding, chest pain, shortness of breath, or swelling in your mouth or throat, do not wait. Go directly to the emergency room or call 911.
Patient-reported outcomes. St. Elizabeth values your feedback. Here's how you can share your recovery journey and experience with us.
As part of your recovery journey, you'll be asked to complete several online assessments at different points in time, typically before surgery, at 3 months, and again at 1 year after your spine surgery. These surveys are standardized tools used across the country to help healthcare providers compare outcomes and track patient progress in a consistent way. While some of the questions may not seem directly relevant to your specific situation, they are part of a national framework that allows us to evaluate your recovery and measure improvements in your overall quality of life. St. Elizabeth Healthcare and your surgeon use this information to monitor your progress and ensure we're delivering the highest quality care possible. Your participation is incredibly valuable, not just for your own care, but for helping us improve outcomes for all spine surgery patients. Each survey takes about 15 minutes to complete. You'll receive an email a few days before your assessment with all the information you need to participate. If you don't have an email, we'll reach out to you by phone instead. You'll notice that the same questions are asked at each interval. This is intentional. It allows us to track your progress over time and see how your function and quality of life improve. Note, these surveys are required by the federal government for Medicare patients, but we encourage all patients to participate regardless of insurance status.
If you have any questions regarding this information or your upcoming procedure, please reach out to the Total Joint Coordinator at 859-301-0405 or send an email with your questions to askortho@stelizabeth.com. Thank you again for choosing St. Elizabeth Healthcare. We are proud and privileged to provide services to you and want you to have the best patient experience possible.